Well, vaccine eligibility is expanding, and you're likely to start seeing more friends and family members getting their shots. But there are certain neighborhoods where access to a vaccine is still pretty limited. Joining me now is State Senator Josh Becker to talk about his appeal to the state to get these communities that are hardest hit a little bit more access. Senator Becker, there's communities in Palo Alto, which is the area that you represent, that were pretty hard hit by the pandemic, yet they're not necessarily having the easiest access to the vaccine. Can you talk to me about which communities there in your area those are, and why is the access so limited there?
Well, yes, we're talking about communities like East Palo Alto. This is a community where 1 in 6 of the population has gotten COVID. So you're talking about 1 in 4, maybe 1 in 3 adults who have gotten COVID. And that's because this community has been on the front lines. They have been, many of them have been essential workers in our communities, allowing many of us to really work from home. And they've been there for us. And so we need to be there for them.
So I guess that's the question, why is the access so limited there?
Well, I think it's a couple things. We need to have more focus to reach these communities. And that's what the county is doing now. So, for example, in San Mateo County, they actually canceled their mass vaccination clinic for the next week or two so they could focus on communities like East Palo Alto, North Fair Oaks, Bellhaven in my area, Daly City up in the north of the county. But what I'm calling for here today is we need the state to expand eligibility to the people in those communities, to really everyone 18 plus. Because right now, there's a 2-step process to get a wristband, to make sure they're from the community. They have to have an attestation form as say they're eligible, but many professions are not included: house cleaner, construction worker, gardener. And if they're unclear about eligibility, people in these communities don't want to take a slot from someone who might be, they think might be more deserving. So we need to really make it easier for these people to sign up. Also, many are living in crowded homes. It doesn't make sense for a 49-year-old in a community that's been hard hit to drive a 70-year-old and not be able to get vaccinated himself or herself.
So are you saying that there are people who are younger in these communities that don't believe they're eligible, so they're kind of foregoing getting the vaccine that is potentially available to them?
Yeah, it's both, right? So as people are unclear about eligibility, many also work informally. I had a friend I was talking to, she was taking care of 7 kids that day. I said, you qualify as childcare, but she wasn't professional childcare. She wasn't sure if she qualified, and therefore she wasn't going to go out and get the vaccine. So we're having to convince a lot of these people, no, you are eligible. And so we need to, that's why I'm calling for this today, we need to relax the criteria for these hard-hit communities. Again, many people live in crowded homes with very many people in them. We have to just make it easy as possible for these folks to sign up, and that's where we have to take this step.
Okay, so as of right now, what resources are available to these folks? Because you just said you spoke with someone. Are you all making phone calls? Are you knocking on doors? What exactly are you doing right now on the ground to help make sure these people understand what the eligibility requirements are?
Yeah, so literally they're going door to door in these communities. The city staff and working with folks like the Ravenswood Health Clinic have done a fantastic job. So again, they're out there now in the community, which is what needs to happen, and the county is providing resources. But what I'm saying is, again, let's make it the easiest possible. When we get one of these families in a hard hit community, let's vaccinate the whole family, right? Let's get it done. Let's not make them worry about, hey, do I fit? Do I not fit? These are communities with such spread. We should get everybody done in those communities. And once you hit about 1/3 of a city getting vaccinated, then the odds are you're going to know somebody who has gotten vaccinated, which again also is helpful to allow more people to come forward who might be qualifying. So we're about 25% in East Palo Alto. So it's really important we get to about 33% as fast as possible. Then you're going to know somebody who's gotten it. You're going to also feel more comfortable. That's going to overcome that vaccine hesitancy that I think you referred to. So that's why we really need to take these steps.
Well, I guess the big question, though, is is there enough vaccine available to open it up to as many people as possible?
We have enough vaccine for these, for these hard-hit communities. I mean, we all know where these communities. I've talked to other state senators, Senator Cortese, Senator Weiner. We all know where these communities are in our areas, and so yes, there's still limited vaccine overall, but there is vaccine coming in. And to get a community like this, to get another 1,000, 2,000, 3,000 people, that's all we need to get to that 33% threshold, and then onward from there. So yes, we still want more vaccine from the state. We've also been asking the state to prioritize our hard-hit communities and hard-hit communities in the Bay Area, and not just in other parts of the state. So that's part of the effort. But this eligibility requirement piece is also a really important one.
Well, the president just said today that by April 19th, all adults 18 and up will be eligible to get the vaccine. Do you feel that timeline is too far out for these communities?
I do, because, and even here in California, it's great. The governor has shown great leadership, has said April 15th, everyone will be eligible. But then that's going to be a huge rush. And I'm worried that these people in these communities are then going to get further and further behind. Because, again, many of them who are eligible, some of the reason they have not gotten the vaccine is because they're working one or two, or sometimes 3 jobs, and they don't have the time to go out to a mass vaccination site. So I'm worried that, or people who don't have the technology resources to sign up, or the language capability. So I'm worried these people will get further and further behind. So that's why I think we need to get expanded in these communities right now.
Does the county, is the county able to just say, okay, we're going to change the eligibility, or does this have to go through the governor and the state's health office?
I'm calling for it at a state level. It's not entirely, as with some things in the pandemic, it's not entirely clear. I just read today that Contra Costa is planning to go to 16 plus really for everyone.
Right.
So it's not entirely clear, but I believe we should do this at a state level so that these hard-hit communities, I just saw another story today about Latino communities across California and really across the country that are under-vaccinated. And we need to, if we increase eligibility in those hard-hit communities, that's really our priority. I think we're at a point now in this pandemic, no one else should die from this virus. And we need to make sure that happens. And by focusing on these hard-hit communities, that's how we're going to make sure that nobody else dies from this pandemic.
Right. So this call stems from your hard-hit communities there in Palo Alto, but you're thinking of the other hard communities hit across the state as well.
Absolutely. Yeah.
Anything else you'd like to say that your office is doing right now to try and expand access to vaccinations?
Yeah. Well, first of all, if people are out there and they're having trouble signing up, again, for language barriers or, technology resources, they don't have the computer access, the Wi-Fi access, they can reach out to our office. We're helping people and directing them to resources so that they can get signed up. So please feel free to reach out to our office.
All right. Thank you so much, Senator.
Thank you for your time.
Mm-hmm.